Third case. A 56-year-old man accompanied by his son presents to the OPD with complaints of slowness of movements, expressionless face, short steps while walking since 10 months. He also gives history of tremors which are present only during rest. So these are resting tremors. On examination, vitals were stable. Tremors are present in hands during rest. Expressionless face was there. On CNS examination, rigidity is present over the upper limbs and gait abnormality is present. So what is the most probable diagnosis in this case? What is the etiology and treatment? Then list 5 functions of basal ganglia. What are the major connections within the basal ganglia and what are the ocular signs which are present in this condition? In this case, there is a classical triad present, that is presence of resting tremors, bradykinesia and rigidity, and this occurs in case of Parkinson's disease. And Parkinson's disease occurs due to the loss of dopaminergic neurons. So basically at the level of the substantia nigra there are certain nerve cells which produce dopamine, and it is a degeneration of these dopaminergic neurons which causes Parkinson's disease, and this disease can also occur due to phenothiazine use and repeated head injury. So what will be the treatment? Treatment include, obviously, since there is loss of dopaminergic neurons, we have to replace the dopamine. So there is L-dopa drug which is given for dopamine replacement. Apart from that, anticholinergics, dapranil and glomerulus transplantation can also be done. So what are the functions of basal ganglia? Well, it is involved in planning and programming motor activities. Then it also regulates cognitive functions. It helps in articulating words and regulation of gross movements. Plus, it is important for posture control. Basically, the signals from basal ganglia go to the cortex and then cortex signals come back to the basal ganglia, and it is important for the decision of initiation of any movement or breaking of any movement. So whether we want to initiate the movement or to stop the movement, that decision is made at the level of the basal ganglia. Then what are the major connections within basal ganglia? It includes nigrostriatal projections, that is from the nucleus substantia nigra to the striatum, and the lesions of this projection cause Parkinsonism. Then the other way around also, from the striatum to the substantia nigra nucleus, and a lesion of this projection cause the Huntington's disease. And then there are subthalamic nucleus projections as well. Then what are the eye signs, ocular signs which may be present in this condition? Well, it may be reduced blink rate, presence of reflex blepharospasm, then reversed Argyll-Robertson pupil may be present, very rare though, that the pupil will actually react to light but not to the accommodation. And finally, there may be blepharoclonus.